Imagine living in a world where heat waves make thousands of people sick every year, where mosquitoes carry diseases into places they've never went before, and where hospitals struggle to care for patients during storms and floods. That world isn't far away. It's already happening. Climate change isn't just about melting ice caps or rising oceans. It's about our health. Every year the Earth is getting warmer. The Intergovernmental Panel on the Climate Change says the last decade was the hottest ever recorded. The rising heat leads to more extreme weather like hurricanes, wildfires, floods, and heat waves. These events don't just hurt the buildings or environments, they hurt the people too. Today I'm going to talk about how climate change affects our health, by the challenges our health systems face, and what science and governments are doing to help. By the end of this speech, you'll see that climate change is not just about the environment, it's about our safety and well-being and the future of us. So what is climate change? Simply put, it's a long term and that changes Earth's weather patterns and temperatures. Most of it comes from human activities like burning fossil fuels, cutting down forests, and industrial pollution. These actions produce greenhouse gases like carbon dioxide, which trap heat in the atmosphere. The effects are not just about hotter summers. They involve higher temperatures, stronger storms, rising sea levels, and changes in rainfall, which all affect people's health. For example, heat waves are becoming longer and more intense. The CDC reports that between 2004 and 2018, heat waves caused an average of 702 deaths per year in the U.S. Heat also leads to more hospital visits for heart problems, strokes, and breathing issues. Climate change can affect everyone, but some people feel it much more than others. Not everyone is equally affected by climate change. Low-income communities, marginalized groups, and countries with weak health systems are hit the hardest. A review in Frontiers of Environmental Science and Engineering shows that people who are in poor or socially disadvantaged face higher risk from heat, air pollution, diseases, and malnutrition caused by climate change. For example, during heat waves, people without air conditioning or clean water are more likely to get sick. Cities with lots of concrete and little green space called urban areas can be much more hotter than surrounding areas. In developing countries, the problems are even bigger, from rising sea level floods, forcing people out of their homes, increased exposure to waterborne diseases, and makes it even harder to reach hospitals. This shows that climate change doesn't hit everyone the same way. The most vulnerable people often suffer the most, and solutions need to focus on protecting them first. Even hospitals and clinics face problems because of climate change. They have to handle more heat-related illnesses, injuries from storms, and outbreaks of diseases. A review in the BMC Public Health found that most health systems are not fully ready to handle these challenges. Problems like not having enough trained staff to help with emergencies, not having enough supplies or emergency resources, and buildings and infrastructures that cannot stand extreme weather. For example, if a hospital loses power during a heat wave or hurricane, patients may need to be evacuated, which can be dangerous. Health systems also need to handle more chronic illnesses like asthma that worsen with heat pollution. This shows that climate change is not just an environmental problem. It is a health problem that affects systems, communities, and individuals. Even if you're not being affected, someone is being affected by it. Climate change affects health in several ways. Extreme heat can cause heat strokes, dehydration, heart attacks, and breathing problems. Groups like the elderly and outdoor workers are highest risk and more vulnerable. Warmer temperatures and changing rainfall allow mosquitoes and ticks to spread diseases like malaria and Lyme's disease to new areas. The Singapore Medical Journal says that climate change is already changing where these diseases appear. Experiencing extreme weather, losing homes, or worrying about climate disasters can lead to stress, anxiety, and depression. Communities hit by repeated hurricanes or floods often show higher rates of mental health issues. Health workers, farmers, and other outdoor workers face heat, smoke, and air pollution. Because of this, it puts their physical and mental health at risk while they try to care for others. There are ways to adapt to climate change. Health systems can become more resilient by improving infrastructures, training health workers better, and early warning systems. Hospitals and clinics should be able to withstand storms and heat with backup power and water supplies. Staff need to know how to treat heat-related illnesses and diseases that are linked to climate change. Communities need alerts for heat waves, floods, and diseases and outbreaks to stay safe. The government also needs to act. Reducing greenhouse gas emissions will help slow climate change. While funding public health adaptations protects people, policies that integrate climate change into city planning, hospitals, and emergency services are all essential. Individuals can help too. For example, reduce personal carbon footprints by conserving energy or using public transportation, as well as support climate health policies and programs. Prepare for extreme events by staying informed and helping vulnerable neighbors. By combining personal actions with worldwide changes, we can reduce health risks and protect our communities. In conclusion, climate change is more than an environmental issue. It's a public health crisis. It affects physical and mental health, increases disease and risk, strains health systems, and worsens inequalities. Studies from Frontiers of Environmental Science and Engineering and BMC Public Health show that adaptation is possible, but it requires urgent action. Climate change is already affecting lives, and the people who are most vulnerable are suffering first. Understand the risks that help us act through policies, personal choices, and supporting resilient health systems. For example, joining a group in your local community or just trying to get involved in your community with stuff like climate change. Remember, the health of our planet is directly linked to the health of our people. The sooner we can all act together, the more lives we can save. Although you may think it's silly and worthless, the quicker we come together, the quicker we will start to see change. For example, doing little things just yourself can help. Even though you think it may be silly and just by you as one person, it won't be able to make a change, it can. For example, by just riding the bus if you live in a big town can help with pollution. Little things you do can help big change.